Still continue to have some slight abdominal pain. She calls it about a 5 to 6 out of 10, which has been relatively stable since she was admitted on the 14th. Otherwise, she's been tolerating her diet well. We switched her to softs yesterday. Still having some diarrhea, 4 to 6 episodes a day, which is down from 10 on admission. Otherwise, she still has those skin lesions that are kind of new to her. So they're doing well with the warm compresses that we started 2 days ago. Otherwise, no complaints this morning. Her vital signs are stable. Eyes and nose are evenly matched. Pulse is 60s to 70s, and her blood pressure is good. Physical exam is unchanged. She still has some moderate tenderness to mild palpation. For assessment and plan, this is our 2-year-old white female with Crohn's disease who is status post-colectomy and J-pouch formation, who was admitted due to Crohn's exacerbation and has been started on Cipro and Flagyl. So for her Crohn's exacerbation, she's on day 4 of Cipro and Flagyl IV. She's also on IV Solumedrol, 60 milligrams daily. I think it's appropriate to switch her over to PO, Cipro, Flagyl, and Solumedrol if she's tolerating her soft diet well. She's still on the maintenance IV fluids at 75 cc's per hour. If she continues to tolerate the diet, I don't think that there's any need for her to continue with the IV fluid maintenance. For her abdominal pain, she's on IV Dilaudid 2 milligrams every 2 hours. She's continuing to request that we stick with this regimen, and I'm fine with that for now. Until we can get her over the hump, we can stick with that same pains schedule. As far as her fluid electrolytes nutrition, her labs are pending this morning. We'll check them, make sure everything's stable, and replace it as needed. She's on heparin sub-Q for DVT prophylaxis, and she's the only other thing I forgot to mention was that her stool cultures are negative and her C. diff is negative times 2.
Okay.
So, as far as disposition goes, assuming she continues to improve and she's tolerating the orals well, the oral pills, then I'm thinking she might be able to go soon. And also, Dr. Herbert emailed Dr. Valentine yesterday to let him know what's going on with his patient.
Good. Any nursing issues?
Excuse me.
No, she's my best patient. Just give her her meds every 2 hours, and she's a very happy camper.
A certain med every 2 hours.
A certain med every 2 hours. She takes care of herself other than that.
Okay, good. Well, let's just go ahead and see her and